First up, we have a well-known local business leader and longtime supporter of our center, Mike Reed of Stebbins Commercial Real Estate.
Ken, Mike and Deb Langton wanted me to return your towel. Ken's the neighbor to the Langtons, and I guess there's a pool over there. This is yours. Good evening. I was asked to roast Ken tonight for a moment, and I really didn't think that I should be the guy because Ken's been nothing but a sweetheart of a friend, and for the past 30 years, and I said to myself, you know, Ken, I have no intention of hurting or embarrassing you, but it has been on my list of things to do, so why not tonight? I had met Ken 22 years ago. I was right out of college, psychology degree, worked at the mental health center, and we dealt with chronic patients from the state hospital. And I was at work one evening, and out in the area where most of the folks would gather, and I was looking into the office, and I noticed a pair of legs sticking out from behind the door, shoes off, feet kind of wrangling around, and I thought to myself, okay, we've got someone in the office, I've got to go in, get them out. Lo and behold, Ken in the office making himself at home. Mrs. Clausen mentioned to me that you have both feet firmly in the air. But that was the start of a great relationship with Ken, and he's been, like I said, just a wonderful guy. And I had just graduated from UNH. I had my 4-year undergrad degree, and Ken boasted about his 7.5 years at Bates. He thought his undergrad degree finally threw him out. And it was, I always found it enlightening because Ken would fill me in about 401k and you're young and you know stocks and bonds and here's all the things you should be doing. And he told me, he goes, you know, Mike, I started out with nothing and I still have most of it. So anyway, by the time we got done that conversation, I thought to myself, if this man's financial IQ gets 50, he needs to sell. Shopping for gold. But I thought, okay, here's my opportunity. I'm going to learn at the knee of a master. So I hung in there, and I knew somewhere along the way I was in danger of learning something. I knew that Ken was an intelligent guy. We all know Ken's an intelligent guy. We know he has the full six-pack, not this six-pack, but this six-pack here. He's just missing a little plastic thing that holds it all together. And talking to Marnie, she says he just has delusions of adequacy. Don't let it bother you. Now, most of you know Ken has had some physical changes over the years. Challenges, I should say. Not changes, they're still male as far as I know. But I would see Ken. I got into the real estate business, and the mental health center was kind enough to retain me to this day, I might add, after 30 years as their real estate person in commercial needs and so forth. So I would see Ken quite a bit, and from time to time he would report to me, oh, I had a knee replacement, a hip replacement, a mishap, a fall, a tumble. I couldn't keep track of it all, so I asked Marnie to get me your medical file. I have it right here, and since I'm not a doctor, and I haven't got the slightest idea what HIPAA means, I thought we would just all talk about it. Marty told me that in the morning, she hears like a little squealing. Little Ken. He reaches over, he's like the Tin Man. Oh, you know how light my arm is now? Do you still have the trick pelvis? Early on in life, that's how Greg's here. Greg, where are you? Oh, Greg. Sorry, Greg's in front of me. You know you're the product of the trick pelvis. So, back to the file. Ken has had his appendix out, a broken ankle, left Achilles torn, staph infections, right knee replaced, left hip replaced, right hip replaced, middle hip replaced. Is that an addictomy? Right Achilles tendon torn, right knee revision. Now see, he has all this great work done and the doctors are fabulous, but he wears crap out. He's got to do it again, so now we're revising. Left knee revision, right knee revision, torn rotator cuff. Ken's got a small apothecary in his basement, and if you ever go to a yard sale at his house, you know what I mean? Braces, crutches, walkers, all out there. Now, thank God Obamacare wasn't around 10 years ago, because I think it would take 259 healthy, young people paying premiums to cover one Ken. He's so worn out, he goes to his gastroenterologist for a semi-colonoscopy. Peter Janelle told me he's retiring because there's nothing left to fix. Now, you know, we had to get Ken away on a little vacation, and I think maybe most of you know that he was able to go over with Marnie to Ireland. Ken's affinity for mishaps, for accidents, followed him right there to the Emerald Isle, and now they got off the bus and out to tour this beautiful castle, and everybody was oohing and ahhing and looking up, and Ken went right in the moat. Cut his hand rather badly. So the drunk bus driver took him to the drunk doctor, who said he needed to go back to the United States. So the drunk pilot flew him back, and he immediately called Peter Janelle and said, Peter, I'm in the hospital. And Peter said, oh my God, I'm in Cork. County Cork. Where are you? What hospital are you in? I'm in the Elliott. Over and back in 36 hours. What a vacation. Well, I was amazed at how much Ken could do to himself. And I finally figured out, and I said I'm not a doctor, but I know there's a number of psychiatrists and therapists and psychologists and doctors in the room. Most of you I've seen on occasion. You're doing fine. But Ken has a disorder known to only afflict a small percentage of the population, characterized by those who get hurt because they're habitually and chronically uncoordinated. Now, if you were a doctor, you might accuse Ken of having Munchausen, which is the abuse of oneself for attention. Munchausen by proxy, which is not, he wasn't hurting anyone else. He was clearly doing this all to himself. But it's a rare illness. It's called Munchausen by clumsy. But you're not alone. President Ford had it. Chevy Chase, Saturday Night Live. You know, I'll just relate one last story and then I'll get off. But I remember not too long ago, Ken was in a hurry. He always tries to be on time, although he never is. And, had all this material, his glasses and phones and whatnot, and was trying to get across Elm Street, trying to get to 1228 Elm Street, and went like a yard sale right in the middle of the Elm Street. Glasses, everything flying. And hurt himself, scraped his hands, knees. Thank God there were two elderly ladies with a Boy Scout across the road. Hustled right into the middle of Elm Street to pick Ken up, ditch the Boy Scout. One of those nice 90-year-old ladies gave Ken her walker and he was able to get to the other side. Ken, I hope you forget most of this. You forget this, but don't ever forget your young son. Like the day you took him shopping when he was 3 or 4 years old and you left him at the store, came up and out. That's not good. 3 years old, made friends with all the baggers up front. Oh, my dad does this all the time. He'll be back. And I just want to thank you for being such a great sport. Hope to hell you're out of town when I retire. But I think you should be committed for all your hard work and everything you've really done to change the perception of mental illness in this community. I don't think there's anyone that's done more, aside from Peter and your whole leadership team, to change the stigma of mental illness. You did that every single day, and the annual meetings, that was evident, and especially now because it's on the front page almost all the time. And I think finally this country is waking up to that mental illness is as serious as a broken arm. It's as real as a broken arm, as a stomachache, as a headache. And I think that you have been probably one of the people on the cutting edge of that. And you deserve a ton of credit.